Of course, in your top story this evening, there's been another health scare in Gauteng involving infants. 9 premature babies have died at the Rahima Moosa Mother and Child Hospital over 4 months this year alone. A bacterial outbreak, necrotizing enterocolitis, occurred between March and July this year. 43 cases were reported to the hospital. The disease affects the intestine of a premature infant, and earlier this month 6 babies died at the Thelle Mogoerane Hospital in Ekurhuleni from an antibiotic resistant strain of klebsiella. We're now joined by our SABC reporter Nozintombi Miya. Very good evening to you, Nozintombi. Firstly, take us through the shocking details around this and definitely the cause of concern.
Well, thank you so much for having me, Shante. We first heard about it during the course of this week, and obviously this came at the very back of the fact that South Africa, Gauteng in particular, Gauteng public hospitals are dealing with the klebsiella outbreak that's affected a lot of children. We know that 6 infants have died. So when we heard about this, we then made sure that we spoke to the relevant authorities, healthcare authorities, specifically at the Rahima Moosa Hospital, who then confirmed that they had 9 infant deaths between March and July of this year. 43 cases that were reported, and it was as a result of the this NEC disease that it seemed to have sprung out of nowhere.
Yeah, essentially just take us how this NEC disease comes about. We do know that it is in somewhat of a bacterial form, and it's also concerning because this is something that is preventable, and now we're seeing innocent lives being lost.
So what we know about this disease is that it affects specifically premature babies, and it affects their stomach lining, their intestinal lining. And once it affects the stomach intestinal lining, there's bacteria inside the stomach that starts eating away at the lining. And once that happens, all that bacteria starts seeping out into the stomach area. It's called the bulb area of the infant, and that starts to generate the inflammation and the infection. And we see that these children specifically are affected, these premature babies are affected if they are taking formula milk instead of taking breast milk. So what Rahima Moosa has done is they did an investigation to try and ascertain whether the formula itself was infective or whether it was as a result of other causes, lack of cleanliness or insufficient quality control when it comes to infection and diseases control in the public hospitals. And they're struggling to find an actual cause of what could have caused this. And I think that's probably the most concerning part of the entire illness. 9 infants have died, and the hospital, the public hospital sector is telling us that they're battling to find the actual cause of what sparked the NEC disease.
Let's just have a look at the overall control measures that we're actually seeing, or the lack thereof, in our hospitals in Gauteng.
Well, we do know, specifically with the klebsiella, a lot of our public healthcare sectors have faced quite a bit of criticism with regards to their inability to make sure that they contain diseases that are airborne or diseases that do spread. And I'm not sure whether you've been in a neonatal ward. The children it's a very small space, and they're in little hubs or little units where it's quite easy for them to catch one illness from the other. Ideally, hospital staff, specifically the nurses that do deal with the infants, the premature babies, are supposed to put gloves on and put masks on to make sure that they're not passing on one illness from the other. But clearly there's been a breakdown in how the healthcare has been done and in the quality control in that. So that stems from that part. Clearly there was not enough regulation when it comes to the control of making sure that nurses have scrubbed properly, they're wearing the correct gloves, and that these premature children are kept in a very safe environment.
Yeah. Now, you spoke to the acting CEO of the Rahima Moosa Mother and Child Hospital. What is the word from management?
From management, they're saying they're very concerned, which is very good, because we should be concerned as a nation, we should be concerned as authorities, and we should be doing something about it. It's unfortunate that we seem to be reactive as opposed to being proactive. We shouldn't have seen 9 deaths. We should not have seen 9 premature babies dying as a result of them getting the very nutrients they need. Premature babies are not able to suckle, therefore they need the formula. And it's very concerning that the formula itself is creating, or it is part of the problem that's creating the NEC. So the acting CEO is very concerned about this, and they are continuing with the investigations. We spoke very briefly to the unions, Nahau and Denosa. They also have been made aware of the situation, and they themselves are also going to be investigating. So the good thing is that there has been momentum gathered to make sure that there is justice for these 9 lives, and also make sure that in future we don't see a further outbreak or a reoccurrence of the outbreak that seemed to have been controlled by August this year.
Definitely. We thank you very much for your time this evening. That was SABC's Nozintombi Miya on the deaths of infants at the Rahima Moosa Hospital, also confirming 9, and of course 9 infants too many. In some other news this evening, the role played by the late ANC stalwart Winnie Madikizela Mandela during the liberation struggle will also be point of discussion in Johannesburg this evening. ANC President Cyril Ramaphosa will be delivering a Winnie Madikizela Mandela Legacy Lecture at the City Hall. Well, the ruling party has dedicated a week of activities to honour her struggle as well as her sacrifices during apartheid in South Africa. She would have celebrated her birthday on September the 26th. President Ramaphosa and Mama Winnie had also shown very close ties in the coming months just before her death earlier this year. Well, senior ANC officials are expected to join the president this evening, and for more on this, Abongile Dumako for SABC joins us on the ground. A very good evening to you, Abongile. Just take us through today's program.